Hi, my name is Dr. Azlım Bekar. I'm a New York-based child and adult psychologist. Today, I will talk about how to protect our young children's mental health during the pandemic. The information that I will provide today will be relevant to post-pandemic days as well, but we thought that this might be handy at this time. With this presentation, I'm targeting parents of children who are between 18 months and 5 years of age. So I'd like to start by saying that babies, toddlers, and young children have mental health needs just like we adults do. Because if we put ourselves in their shoes, we can see that they lost their social connections with relatives, friends, and teachers. They lost their weekly and daily routines, and as a result, they can feel worried, scared, frightened, sad, angry, or bored due to restricted level of activities at home, right? But they cannot really verbalize or process their emotions in the way that adults can do. So what do? They can throw tantrums when they have distress and difficult emotions that they cannot understand or process. Or they can show clingy behaviors. They can seek out more touch with you, more cuddling, more physical proximity. They can show sleep disturbances. They can show changes in their appetite. They may overeat or undereat. They may act in a hyperactive way if they are in distress. And they might show transitioning problems. So they might have difficult time stopping one activity and going to the other. And play is really important. It's an area that we look at when we try to understand children, because language of children is play. And if they have distressing emotions, they might withdraw from play, or they can show extremely controlling behavior during play. So they can tell you what to say or how to act in pretend play. Or they can show hostility towards you, towards whoever they are playing with, because they may not be able to tolerate the emotions that come up during pretend play. So what can we do? Having a routine is really important, because routines and structure decrease children's anxiety. But here it's really important to be flexible, because rigidity increases anxiety. Being flexible decreases children's anxiety. So I recommend that whatever routine that you want to adopt, you treat it as work in progress. And explaining the pandemic in an age-appropriate way is really important for children. They can understand sickness, safety, preventions, and they are also seeing a lot of people acting in different ways. So now the neighbors are not coming close, they are closing their faces with a mask. So they need to make sense of these changes, and the best way to really tell them what's going on is to be straightforward and make sure that you answer their questions without volunteering too much information. Okay, so the balance is really important here. Getting fresh air is helpful, just like it helps us if it's safe for the family. Having online play dates help children in the sense that they understand that their friends have not disappeared. They're just sheltering in place, and there's a good chance that they will see them again. Similarly, going and visiting their school building may tell them that the school is closed. They are not the only one who are not going to school. They are not pulled back from school for any reason. And you can also talk about memories that they had, like nice memories that they had in school, such as singing or reading books, names of teachers and friends. It also, these type of activities also give them a sense of coherence and stability and hope. Hope is really important for children. So it's important to tell them what's being done about the COVID-19, and that the doctors and everyone are working really hard to make them go back to school. improving your own mental health is important because it really affects the way that we treat our children. So looking inside and seeing, realizing your stress level, and if it's really high, trying to decrease it is important. You can try mindfulness exercises, meditation. You can double check with yourself if you have enough help and if you can ask for more help. These all help in terms of regulating your own emotions when difficult moments come up at home during the day. And gently redirecting children from excessive screen time is important. This is a question that we get a lot during the pandemic, because screens are really powerful, and there is not, there are not many alternatives to redirect them from the screen time. So what can we do? I recommend that you try to offer really appetizing options to screen time, but try to do it genuinely. For example, it could be a 30-minute play with them. You might invite them to pretend like you're in a zoo or you're animals in the zoo by initiating the pretend play. It's really important here to follow your child's lead. So if your child wants to play in a certain way with a certain theme, follow your child's lead, because then play becomes the most helpful to them if you let them lead the play. Asking them to join you with daily chores such as folding the laundry, or dancing or singing, or even your physical exercise might be nice alternatives to screen time. Limiting your own screen time might be good modeling. So if you give them the message that I'm available to you, they might also want to make themselves more available to you. And if your child is really into watching something, I suggest that you respect that pleasurable activity, that choice, that hobby, whatever you call it, of your child, and be curious about what he likes, what she likes about it. Make links with the whatever he or she is watching with their actual real lives, and make it more interactional, because this will also decrease the harmful effect of excessive screen time. So watching it together and engaging with your child using something that he likes will give him the message that, oh, I see you, I respect you, I join you, I'm happy with you, and now let's do some other play. Let's play something else. So with that invitation, there is a higher chance that your child will take it. So this was the end of my presentation. Thank you very much for watching.